surgical guides and implant accuracy. So there's been numerous studies that have showed that guided implant placement is far more accurate than freehand placement. The most recent studies have shown about a 3 times more accurate placement with surgical guides avoid freehand alone. So what that means is we're trying to move in our practice to a position where we can almost always place implants with a guide. And that just means more accuracy and precision for you and your general dentist when it comes time to restore them. So how do we apply these principles we talked about in guided implant placement? Well, the first and most important thing is that we've reduced the chair time needed to make guides, and that's important because that means that we can use them more often. Studies have recently shown that guided implant placement is about 3 times more accurate than freehand placement alone. And although we can't use a guide for every single implant placement, we're trying to strive for as close to every single implant placement as possible. And this is important because that makes a reduced chair time for your placement, for your restoration, and how quickly you can get back to function and having a tooth in place. It used to be that it would take a long time to get these guides fabricated, but now they can be fabricated in as little as 30 to 40 minutes, which means you can come in, get the scan done, and possibly even come back later that day and have the implant placed, all within the confines of knowing that you're going to have an accurate placement that follows where that crown needs to be for function. And that's important for the longevity and the success rate of your implant placement. So what are some other applications of guided implant or guided 3D printing in dentistry? Well, now we're finding that even for root canals, we can make a guide. And how is that important? Well, it used to be that the root canal specialist would have to look through the microscope and make an access hole into the tooth to find the small little canals that are running down the length of the root. What the guide does is now we can minimize that access to a very, very small diameter, which means less filling material, a possible less requirement for crown fabrication, and also in highly aesthetic areas like your front teeth, they can make the smallest access possible, which would just be filled with a normal tooth-colored filling material. The other applications are coming into bigger surgeries. For instance, if somebody is having orthognathic surgery or jaw surgery where we need to reposition their jaw for orthodontics or for better function, we can actually make a complete model of their jaws in relationship to the skull, pre-plan the surgery, and have this as a guide. Why this is important is before this used to have to be done all with stone cast models and required a lot of precision from the surgeon and was operator dependent. So maybe you would have a good outcome or maybe there would be complications, but we didn't know that going in. We would have to find that out during the procedure. Now we can find out about potential complications and have a backup plan in place so that we're always prepared for any eventuality during the surgery.